Ladies and gentlemen, good morning. It's exactly 4 minutes past 11. My name is Eric. I will be a moderator for the session, and welcome to this session brought to you by Humanitarian Global. And with me, I have two people. I have Anthony, and I'd like to invite Anthony to say something before we begin. Anthony, are you there with us?
Thank you, Eric, and I hope you can hear me loud and clear. And to all of our participants today, I can see you have joined the meeting right on time. And we can also see that we have other participants who continue joining us. So as we get ready to start the session, we would like to encourage you to continue sharing the invitation details to your colleagues and also friends so that they can also join the session and also benefit from the same. So before I take you through on a brief of maybe information about Humanitarian Global, I would like just to mention something. As you registered for the event, we were able to capture your email address, and that is what we normally use to communicate to you. So that is in terms of sharing the recorded version of the session that we have hosted, and also sharing the presentation slides. So what I would like to encourage you, so just try to refrain from sharing the same details on the chat section. So there's no need for you to reshare your email again. So we already have your email in our database. So that means you don't have to worry about you getting the slides and also the recordings because we already have captured your details. So with that said, let's try to refrain from sharing the email addresses on the chat section. Let's maintain the chat for communication, and also when it comes to questions, it's advisable for you to consider posting the questions on the Q&A section. So that is where we can see all the questions, because if you post the question on the chat section, once we have new chats coming in, your question is going to be pushed up, and it's it can be easily get out of our site. So that means it is recommended for you to consider posting your questions on the Q&A section. So once again, let's try to refrain from sharing the emails on the chat section because we already have your email addresses. So with that said, I would like just in a quick way to take you through on a brief information about Humanitarian Global. So this is an institute that is based in Nairobi, Kenya, with our main focus being to work with both humanitarian and development professionals like you when it comes to capacity building. So that is what we do, and we normally support learn on the go, where we want you as a professional, you as a humanitarian, you can study at your own pace, at your most convenient time, using your most convenient mode of learning, be it through your mobile phone, be it through your tablet, your laptop, or maybe any other smart device. So that means you can easily study within your convenience. With that, we also make sure that apart from training and learning, which is our core area of focus, and under this category, we ensure that we can offer online courses and training programs, which are well enlisted on the website. We also do organize for webinars like the one that we are having today. We also do organize for and also host training workshops. This is where we can conduct a need analysis, know what is your capacity needs, and then we are able to bespoke a training for you and also for your organization. We also do host conferences. We also do work with organizations when it comes to capacity development and also team building. So that is under the category of training and learning, what we manage to cover. In addition, we work with a pool of experts when it comes to training and learning. And that would mean that in case you have an inquiry, you'd like to be taken through a certain area, or even your organization is working on a certain project and they need to seek professional advice. That means you can contact us, and through our experts, like the one that we have for today's session, who is Ross, we can always get and support you in that regard. Thirdly, we work with the humanitarians to make sure that we can share their work. So through our platform, you can share with us your humanitarian initiatives and projects that you're doing, and then we can publicize the same on our platform. Lastly, we have blogs on the website, and this is to keep you informed. So that means through our website, and that is through this section of resources. You can find a variety of blogs there. There are quite many, and we do write across different areas. And I'll be taking you through in a short while some of the areas that we cover. We also do have publications, and then you can access them from that section. At Humanitarian and Global, we cover a wide variety of areas when it comes to training and learning. And some of these areas that we do manage to cover, they include monitoring, evaluation, accountability, and learning. That means even if today's session is about WASH, you can also reach out to us in other areas when it comes to training. We also do train on water sanitation and hygiene, that is WASH. We also do train on disaster risk reduction and management, DRRM, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant, and young child nutrition. In the month of September, we're going to be launching training on public health, project planning and management, gender-based violence. We already have training on data analysis. And then also later this year, we're going to introduce a training on child protection and livelihood support, and also climate change without forgetting humanitarian principles and essentials. So that is just a list of the areas that we cover when it comes to training. So we are excited to have you, and we encourage you continue sharing and spreading a word about Humanitarian Global. I know you are eager to know what we have for you for the day. And without taking much of your time, I would like now to invite Eric again, who is going to invite the facilitator of the day, and then we're going to communicate again later on towards the end of the session. So a quick reminder, try to refrain from sharing your email on the chat section. We already have your email address, so there's no need for you to reshare again. In case you're interested in further training with us, you can engage our team, and you can see them there. Their username, it's starting with the HG, and that is on the panelist, and you're going to get assisted. So thank you so much, and let's see what is there for us today in this training of water sanitation and hygiene. So back to you, Eric.
Access to affordable and sustainable water, sanitation and hygiene is still a big challenge to many communities. This has negative impacts on the livelihood, well-being and health of many people across the world. According to a joint program by UNICEF and WHO, it has been established that more than 844 million people do not have access to basic drinking water. A further 2.3 billion people lack access to basic sanitation and hygiene services. In line with UN's SDG 6, which aims at ensuring availability of water and sanitation for all, HumanitarianGlobal.com has collaborated with world's best WASH experts to prepare an introductory course in WASH to empower more people in steering this goal. Undertaking a certificate in WASH program gives you an in-depth knowledge and understanding of Introduction to WASH. In the first module, the learner will get to understand the fundamental principles and approaches in WASH, global availability of fresh water, right to water and sanitation, and the post-2015 WASH development agenda. Secondly, sanitation and hygiene. This module allows you to learn about sustainable sanitation, sanitation in schools, hygiene improvement and disease transmission routes. And thirdly, cross-cutting issues in WASH. In this last module, the learner will get to study some of the cross-cutting issues in WASH, such as participation, gender, environment and inclusion of the most vulnerable community members. To register, please visit our website www.humanitarianglobal.com for more details.
Thank you, Anthony, for that introduction. And our second person is our key speaker for today. Rose, are you there?
Yes, Eric, I can hear you.
Welcome, and the floor is yours.
Okay, sure. I hope I'm audible enough. Can you hear me?
Yes, I can hear you audibly.
Okay, thank you. Okay, thank you so much, Humanitarian Global, for today's session, and welcome participants for this session today. So just give me a minute. I share my screen. Let me know if everyone of you is able to see my screen.
Rose, can you try to share again? We cannot see your screen.
Okay, let me try again. Let me reshare. Let me know if you are able to see my screen.
Yes, I can see it now.
Okay. Okay, thank you so much. And thank you so much once more, Humanitarian Global, for this session, and welcome participants. So in our session today, we'll be focusing on hygiene promotion. Our focus will be in emergencies, but we'll also have, we'll also touch on a bit on development. And if you have any questions, you can type them in the Q&A chat box, and we'll be able to respond to them. If you have also any comments, you can also send to us. So for today's agenda, these are the key areas that we're going to focus on today. So we will look at some terminologies, and the terminologies that I'll focus on today is on hygiene education, hygiene promotion, and health promotion. We will also focus on sphere standards for hygiene promotion in emergencies. We'll look at components of hygiene promotion. We'll also look at communication in action, and we'll take some time to look at hygiene promotion frameworks and approaches. So to begin with, we'll first look at terminologies so that we are aware on what we are talking about today. So let's begin with hygiene education. Okay, so hygiene education is about provision of education and or information to encourage people to maintain good hygiene and prevent hygiene-related diseases. So the key aspects here for you to understand is in hygiene education is about providing education. That's the key thing. So hygiene, when you're doing hygiene education, is just about providing education for people. So you are not looking at a process of maybe changing behavior, but you're just providing education to a community or to a group of people. Health promotion, I took this from according to WHO. So the focus on hygiene promotion is a process of enabling people to increase control over and to improve their health. So health promotion, if you look at it in comparing with education, health promotion is more of a process that you want to enable people to improve their health. So it moves beyond the focus of individual behaviors. So health promotion mostly looks at a wide range of social and environmental interventions. So the focus on health promotion is on broader health issues rather than just one or those associated with water and sanitation. So health promotion looks at more comprehensive and looks at broader health issues. Now let's focus on our topic today. So our topic today, we are looking at health hygiene promotion. So the definition, this definition, I took it from UNHCR. So hygiene promotion is a planned, it is a systematic approach that enables people to act in a manner that ensures that water, sanitation, and hygiene facilities and services have a positive impact on health. This is a quite loaded statement, but the key thing here is that hygiene promotion is about, it's something that is planned. It's not something that's rushed. So it's a planned process. It also follows a systematic approach. So, and also it enables people to act in a manner that ensures that water, sanitation, and hygiene facilities have a positive impact on health. So another component of hygiene promotion, apart from it being that ensures that people use facilities, is that it also promotes what we call participation, accountability, and monitoring, because it emphasizes the importance of listening and employs what we call dialogue and discussion. The key thing here is that hygiene promotion is about listening to communities, about bringing them on board so that they participate in the decision-making process. So the approach of hygiene promotion, it promotes participation, accountability, and monitoring. So it emphasizes so much on importance of listening, and it employs dialogue and discussion. So these components, as we go on in the discussion today, they'll become clearer and you'll understand the need for participation and accountability and monitoring in WASH projects as using the hygiene promotion approach. One thing I would like to mention is that hygiene promotion is not a standalone component. It's a component that is engulfed within the water sanitation and within water and sanitation. So it's not a hygiene, it's not a standalone component that you use. Hygiene promotion is not. Oftentimes, when you talk about hygiene promotion, most people tell you that hygiene promotion is just about hand washing, but that is not the case. So hygiene promotion should not be reduced to encouraging personal hygiene and hand washing only. So most time when we talk about hygiene promotion, most people think of hand washing as just like it's equivalent to hygiene promotion, but that is not the case. But it usually aims to ensure that ensures the effective and sustained use of wash facilities. It also promotes community capacity and also the action in order to improve public health. For us to understand the need for hygiene promotion, it's important for us also to look at statistics and also look at some data from the field. For us to understand why do we really need hygiene promotion, whether hygiene promotion in emergencies or hygiene promotion in the development sector. So I've picked a few examples that will guide us today. And the first one is from studies that had been done in 2011 and in 2004. And it found that diarrhea and acute respiratory infections accounted for nearly 30% of deaths among children displaced due to humanitarian emergencies, with diarrhea causing up to 40% of child deaths in acute emergencies. The second one is about a study that was done in 2009, and it found that sanitation infrastructure can be overwhelmed quickly with the influx of displaced persons, and water quality can be poor, contributing to high diarrhea risks. The third one is that it's an example from Malawi. This study found that regular provision of soap was associated with 27% reduction in diarrhea, and hand washing with soap was also shown to be an effective strategy against diarrhea or cholera outbreaks. So what we can learn from these statistics is that diarrhea remains to be a key issue in emergencies, and that if there are no sanitation in infrastructure or availability of sanitation infrastructure, but they can sometimes also contribute to high diarrhea risks because of maybe there's an influx of persons. So there's usually water quality surveys are usually affected. Allow me to focus on the third one. So this one showed these studies. There were several studies in 1998 and in 2001 and 2003. It showed that provision of soap was associated with a reduction in diarrhea by about 27%, and that hand washing with soap was also shown to be an effective strategy against cholera outbreaks. Allow me also to give you examples from the development sector that looks also some of the statistics, the need for hygiene promotion in development. So these findings are from non-emergency settings, and it's showing us the relative importance of different wash interventions and the need for hygiene promotion. Okay, so the first one, it's about water supply. So these studies were just about meta-analysis. So it's about, there's so many studies that have been done. So the studies indicated that, so if you provide water supply to a community, the likelihood for reduction in morbidity from diarrheal diseases was up to 23% if you provide water supply only. If you provide sanitation, you are likely to reduce morbidities from diarrheal diseases by up to 36%. If you improve water quality, the likelihood of reducing diarrheal diseases was at 39%. If you improve hygiene, the reduction in morbidity from diarrheal diseases was found to be 42%. And improvement in hand washing practice showed a reduction in morbidity from diarrheal diseases by up to 44%. Please note that for these are just indicative data, because most of the argument at the moment is that we cannot provide maybe one service and not provide another. But these are just indicative to tell us that there's need for hygiene promotion, that if you provide hygiene promotion, the reduction in diarrheal cases are likely to go, the reduction is quite high. So whereas they may not, the individual aspects may contribute, it's important that this studies shows us that there's really need for hygiene promotion, and that reduction in hygiene promotion is contributed by addressing all the aspects of WASH. So there's water supply, there's provision of sanitation facilities, and in water supply, there's also an aspect of quality, and also we have a component of hygiene, and we also have a specific, the last part is about a specific hygiene behavior, which is hand washing. So this statistics tells us that, in fact, that the need for hygiene promotion is crucial, and that if we provide hygiene promotion, we are likely to reduce diarrheal cases by almost by 50%. So why do we need hygiene promotion? So the priority focus for hygiene promotion in any emergency is prevention of diarrhea and diarrhea-related infections. And this is achieved through 3 ways. So the first one is on safe disposal of soap, reducing the contamination of household drinking water. So in safe disposal of excreta, this is about erecting sanitation facilities. And that the second one is about a behavior change, effective hand washing with soap. And also the third one is about reducing the contamination of household drinking water. So this is it tells us that hygiene promotion is in fact one of the most cost-effective ways of improving public health outcomes. Please note that other water and sanitation related diseases also are usually targeted. So it's not just about diarrhea, but diarrhea is usually one of the key disease that we focus on in hygiene promotion. However, there are other diseases also that we focus on, and examples of them also could include malaria or dengue fever. Another reason why we need hygiene promotion in emergencies is to ensure the effective, sustained, and optimal use of wash facilities by all users. Oftentimes when we put up facilities, and I'll use examples of maybe a sanitation facility or a toilet or a latrine, you may find that the facilities sometimes are not used or may be used in a way that was not intended. Sometimes we put up a facility like a toilet, and that because we do not involve the community or have prior discussions with the community, you find that it is likely that they're not used. For example, you might find that maybe the aperture hole in a latrine is big, so you find like children are not using it. You may find that maybe the toilets were constructed very far from where people are living, so you find that people fear going to the toilet. You may find that the toilet sometimes, maybe it was constructed and then maybe it does not provide enough privacy. So you find that people are not using it. Sometimes you put up a system like a sanitation facility, and then maybe there's no system that has been put in place to ensure that it is clean. So if there's no system for cleaning latrines, often you'll find that people stop using them. In such cases, you find that we start seeing open defecation in areas that we have put up sanitation facilities. So the need for hygiene promotion comes in here because it ensures that the facilities that you have used, they are effective, they are sustained, and they are optimally used by all users. Another reason for hygiene promotion is that it supports what we call participation and accountability. For this one, we mean that it involving people in the decisions about wash facilities or how we handle outbreak responses or about designing, siting, and management of facilities is important. So in hygiene promotion, it's about bringing people together, listening to the community, and making decisions based on what the community wants. Another reason also is that hygiene promotions emphasizes on community engagement and participation and can link humanitarian work to longer term development. What I mean here, we have a concept that we call LRRD. So it is a linking relief, rehabilitation, and development. In that you can begin engaging communities during acute emergency phase, and you can work with the community all through until stabilization phase. So hygiene promotion, because it engages the community, it really encourages participation, and you can move communities from humanitarian phase all the way to the development phase. I can give you an example. For example, when we in an emergency phase, maybe in a providing like sanitation facilities. So during emergencies, maybe we put up maybe we put up maybe trench latrines. Those are usually not sustainable, but we move with communities from that phase of emergency, and we move them all up until maybe using eco-san facilities. That's an example. So hygiene promotion, it really emphasizes on engaging communities and also their participation in all the decisions that we make in improving their hygiene behaviors in our WASH. So another reason also is about acceptability of facilities and the impact on health and well-being of communities. So in hygiene promotion, it helps us also to monitor acceptability of facilities. So oftentimes, sometimes we just construct facilities without engaging the community. So you find sometimes the facilities that we've put up are not accepted and they're not used by the facilities. So if facilities are not used by communities, it means then that will not have an impact on health. And we're not, now the impact that we talked about, that we want to reduce diarrhea-related diseases. So that impact will not be able to get it if facilities are not accepted and used by the intended communities. Briefly, let's look at sphere standards for hygiene promotion. So sphere standards, as we all know, they are a set of principles and minimum humanitarian standards. So for us, we're looking at the technical areas. We also have what we call the core standards for humanitarians, but this was now we're just looking at the technical areas for humanitarian response. So we have 4 areas of technical areas. We have WASH, we have food security and nutrition, we have shelter, and settlement and health. So for the minimum standards for WASH, we have many components. We have hygiene promotion, we have water supply, we have excreta disposal, we have vector control, we have solid waste management and drainage. For our session today, because we are talking about hygiene promotion, so we're going to just highlight the minimum standards for WASH in hygiene promotion. And for hygiene promotion, we have 3 standards. So the first standard is about hygiene promotion. So what this means is that it's about making people aware of the key public health risks related to water, sanitation, and hygiene, and that people can adopt individual, household, and community measures to reduce them. To further explain this is that the steps now to attain this standard is that it's about identifying what are the public health risks and the current hygiene practices that contribute to the risks. So when in an emergency setup, so we usually have, we do what we call an initial assessment. So before you do anything else, you do what we call an initial assessment, just to understand what are the current hygiene practices of people or the communities that you're working with, and how are these practices contributing to the risks. The other thing also about this standard is that after you identify now what are the key risks or the key hygiene risks in the community or the group that you're working in, so you work with the affected population to design and manage hygiene promotion and the wider WASH response. We'll explain this when as we go on. You'll be able to understand. So another aspect also about this standard is that another step is about community feedback and health surveillance data to adopt and improve hygiene promotion. So oftentimes we are encouraged in when you're doing hygiene promotion in emergencies is to listen to the communities. For any intervention that you put up, it's important to listen to the community. So when you listen, you are able to adapt some of the maybe some of the interventions that you put based on the feedback from the communities that you are working in. The second standard of hygiene promotion is what we call identification, access to, and use of hygiene items. So it's about appropriate items to support hygiene, health, dignity, and well-being are available and used by the affected people. So we usually have a list of essential hygiene items during emergencies. So what we call essential is these are just the key items that are usually required to be available when you're doing emergency hygiene. So these are the basics. So we usually call these are the basics. So it's about having a water container for collection and storage, provision of soap for bathing, provision for soap for laundry, and then soap and water at hand washing station. And also we have what we call potties for disposal of children feces. Allow me to say that these are just the basic, usually these are the basic items that are usually required to be provided in hygiene promotion during emergencies. However, there are usually other items that can also be provided based on the context that you are working in. And it's important also to work with other teams. For instance, we may be working in an area and you realize that, and working with the shelter team, you realize that they need maybe to provide blankets. So it is also important, even as you're procuring and also identifying the hygiene items that needs to be procured, it's also important to work with other teams. So I've just given you an example that sometimes there needs to be procured maybe blankets for the communities that you're working in. So it's important. In other areas, also we've realized that there are other items that are usually required, also like maybe toothbrush and toothpaste, but those ones are usually based on the context that you are working in. But however, the main items that are usually required are the ones that I've detailed here. So there are steps to attain this standard on provision of hygiene items. It's about identifying the essential hygiene items for individuals, households, and communities in need. So as I've indicated, so this is based usually on the context. There are other contexts that need maybe other or more hygiene items. So it's also about providing them timely, ensuring that there's a timely access to essential items. So identifying and maybe you identify a location where the communities can come and pick their items, and also make sure that you provide them in timely. For instance, if you have to provide them maybe bi-weekly or monthly, so it's also this need to provide the items timely. It's also about working with affected populations, the authorities, and others to plan on how people will collect or buy the hygiene items. So in other areas, we've realized that the items are procured, but in there are other circumstances where people are given what we call vouchers or cash so that they can buy their own hygiene items. So these are just guidelines, and you can adapt them to your context. It's also about feedback, as we talked about before. It's about feedback from affected people on the appropriateness of the hygiene items that you have chosen. Sometimes you may provide an hygiene item and we realize that the community is not satisfied maybe with a certain type of item that you have provided, and also maybe also the mechanism for accessing them. You might find that maybe we have put up a center for people to come and pick the items, but we did not consider like the distance maybe from where they are residing, or you find that maybe most of the people that you are working with, maybe they are the elderly. So you'll find that maybe the mechanism that you propose for accessing the items maybe is becoming a challenge to the community. So it's usually important, even as we distribute the item, to seek the feedback of the people if the items that have been provided are appropriate. The third standard for hygiene promotion is on menstrual hygiene management and incontinence. So this one is about women and girls of menstruating age, and also about males and females with incontinence. So this ensuring that they have access to hygiene products and wash facilities that support their dignity and well-being. So the what is still about, it goes back to about consultation, about understanding the community. So when you're doing the first initial assessment, I'll later share with you an example of a tool. So we usually have a tool when you do initial assessment, you understand the people that who form the group that you are working with. So you understand maybe the type of disabilities that are there. So it will help you now in maybe designing and also the wash facilities. It's also about understanding what do women need. Oftentimes we just usually just provide maybe disposable products for menstruation, but you find at times maybe women are used to using maybe reusable products. So it's important to understand from the girls and the women perspective, what are their practices from maybe from where they came from, and also to understand which materials are they comfortable with. So it's about working with them to understand what are their needs and what products do they use. It's also important to understand that there are people also who have what we call incontinence. So sometimes they need to have maybe more hygiene products like soap. And also there are also people who maybe living with disabilities, so about understanding their wash facilities needs. So for this one, the steps to attain the standards for menstrual hygiene management. So it's about understanding the practices, the social norms, and the myths concerning menstrual hygiene. So it's about working with working with the women and the girls to understand what are their needs, which products do they use, and how do they manage their menstrual cycles. So another aspect about consulting women and girls and people with incontinence on the design and siting of facilities, particularly about the toilets, about the bathing and laundry and disposal and water supply. Sometimes women would need a place where they need to wash their maybe reusable pads. So you need to understand and also agree on where to site maybe some of the facilities. So another aspect also is about providing access to appropriate menstrual hygiene management and incontinence materials, soaps, and other hygiene items. So this is what I've just talked about. It's about the need to provide appropriate menstrual hygiene management materials based on the needs of the women and the girls. We have what we call components of hygiene promotion. So we have six components of hygiene promotion, and these components usually apply in the humanitarian or in emergency setups. So we have community participation, we have use and maintenance of facilities, we have selection and distribution of hygiene items, community and individual action, communication with stakeholders, and monitoring. So, and I'm going to go through each of these so for us to understand more about these components. So the first component that we'll talk about, which is about community participation. So community participation is about consulting the affected persons on the design of facilities, the hygiene kits, and identifying the vulnerable. So the first thing about community participation, so when you are working in humanitarian setup and you're in charge of hygiene promotion, so the first really component that is important is about community participation. So it's about consulting the people that you are working in the design of the facilities. And this one we will see around in our webinar today, with the examples that we will give on the need to listen to the communities. So it's also about understanding the needs of different groups and allowing them to make decisions about the wash interventions. Oftentimes, when we are working in, whether in the development space or in the humanitarian space, oftentimes we usually have predetermined interventions that we want to give to people. But it's important to first listen to the different groups and then allow them to make you work together and allow them to make decisions about the interventions that you want to put up. The second component is on the use and maintenance of facilities. So this one's about ensuring that facilities are acceptable to different users, they are well maintained, and they're used sustainably. And this is the one I talked about when I was giving an example about sanitation facilities, that we need to ensure that the facilities are acceptable to different users, that we have children, we have the aged, and then maybe we have people with disability, with different types of disabilities. So there's a need to ensure that the facilities that we are putting up, they are also acceptable. And not only are they acceptable, they're also well maintained and they're used sustainably. Because when the facilities are not well maintained, you'll find that people will just leave the facilities and not use them again. This one also is about encouraging ownership, responsibility, self-reliance, and sustainability. So when putting up facilities, for example, whether it's a water facility, whether it's a sanitation facility, whether it's about hand washing facility, when you bring communities together, they're able to ensure that they use the facility very well, they are maintained, and also they feel that they own the facilities. So this one really ensures sustainability. The third component is about selection and distribution of hygiene items. So this is about distribution of hygiene items or cash alternatives to ensure that people are enabled to maintain their hygiene and dignity. And also it's about involving women and men in the selection process and obtaining feedback on use and satisfaction. And this is what I talked about, giving examples on when you want to identify the items that you want to buy. There have been cases sometimes when you procure soap, for example, and maybe the people that you are working in have never seen maybe a brand of soap that you have bought, and you find that people sometimes confuse their hygiene item, thinking that maybe it's a food item. So it's important to involve people in the selection and also identifying where even to get the hygiene items. And also, as we've talked over and over, it's about also getting feedback on the use and satisfaction. When you do this one, we'll talk about it when we do monitoring. When you get feedback, you may be able also to change the approach that you have been using in the distribution. You may also help you maybe to change like the mechanism that you're using in the distribution of the hygiene items. So this is what I was talking about, that you'll find that people will not always use items distributed for the purpose for which they were intended. One example is about soap. So we usually provide soap assuming that people will use soap for hand washing, but you find that sometimes people are supplied with soap and they do not use it for hand washing. So it's about engaging the communities and also making sure that they understand what you are distributing and the use for each items, and making sure you understand, the community understands each item that you provide. The other component is on community and individual action. So this one is about when communities are engaged. This is about using the principles of behavior change, also about training community-based volunteers as hygiene promoters. It's also about organizing community activities such as dramas and engaging individuals with home visits. So this component, I'll explain it later when we'll be looking at examples for you to understand how we are using the principles of behavior change and about engaging communities so that they can take action. They take action as an individual and also as communities. The other component is about communication. This is about collaboration. So as I talked before, I said hygiene promotion is not a standalone component that you implement. It's implemented within the wider WASH project. And in the wider WASH project, we have many partners. So it's important to collaborate with the partners and governments to prevent what we call duplication. And also we ensure that we are there's cost-effective use of resources. So collaboration, it is an aspect that should appear and it should be embraced by all, and even during implementing hygiene promotion activities. So the last component of hygiene promotion is in what we call monitoring. So this one is about monitoring. So monitoring, as part of monitoring and evaluation of WASH activities, it is important to collect and analyze and use the data. So there's an aspect of collecting, there's analysis and use of data. So oftentimes we find as humanitarian workers, we are so busy, and sometimes we collect the data and we analyze the data and we never use the data. So the main reason for monitoring is for you to shape and adapt the program that you're running. When you monitor a project, even if it's just hygiene, the hygiene promotion component of the project, it will help you to understand whether the hygiene items, for example, are appropriately used. It will help you understand if there is optimal use of facilities. It will also help you understand if communities are satisfied with the facilities that you have provided. And after now getting this data, you use the data to shape and adapt the program. So monitoring is really key in any project. So whether it's hygiene promotion or the wider WASH project, it is really important to monitor the project. And it gives you maybe the gaps and also helps you to understand if you're really meeting your objectives. So those are the key components of hygiene promotion. And these components you'll understand even as we go further when we look at the approaches of hygiene promotion. Just allow me to share how to implement a hygiene promotion project. So it uses the project circle, the normal project circle. So this one I borrowed from the WASH cluster. So it is what we call, it follows a circular process. So it begins here with a rapid assessment planning. Before you implement anything, it's important to do what we call a rapid assessment for you to understand the community that you're working in. It helps you to understand their hygiene behaviors, you understand the groups that you are working in, and also to understand what we call what are the available ways of communicating. So it's usually a very comprehensive plan that's usually done rapidly, because in emergencies, you don't have the luxury of time, like having like a whole week or a 3-week time, maybe to do an assessment, but it's usually done very within the first week. So it's usually a very rapid assessment. And then for you just to understand the group that you're working with. And then the second phase is about implementation. So in implementation, we usually identify and train our volunteers, because you need to work with volunteers. And also you, after identifying, for example, maybe a communication approach. So that's where maybe, for example, here we're talking about maybe using mass media. We'll discuss this one more as we go. And then also in implementation, it's about distribution of hygiene items and also designing of the communication plan. And then here we have what we call a baseline survey for you now to understand after implementation, because this is usually done, the rapid assessment issues are done very fast. And after implementation, you can now do a baseline survey that will help you now evaluate your project. Okay, so then we'll have what we call here monitoring. So the key areas is what we've talked about. It's about acceptability and use of hygiene items. We'll also about use of facilities. It's also about hand washing and feedback from the community. And then now about evaluation. So evaluation of the WASH intervention as a whole, because as much as we're just talking about hygiene promotion today, but it's usually within the WASH project. So it's within the WASH intervention. So the implementation really follows the normal project circle, and usually a circular process. So it begins with an assessment and ends with what we call a review. What we call also, we're talking about being iterative process. So it's about back and forth, just going back to the community again, just to understand them. And what it also means is about feedback. So when you get feedback and lessons learned, you incorporate them to the program, and so that you ensure that you're meeting the appropriate needs of the affected people. So it's iterative, and so it's about learning, and whatever you've learned, you incorporate them to the program and make the program more better and more responsive to the people that you are working in. So later you will maybe be able to open this Word document here. So this it's just a simple tool, an assessment tool that's developed from, you will find it under Sphere. But this is a tool that you can adapt to your context, because contexts are different. So it is a simple tool, so you don't need to reinvent the wheel again, but you can look at the tool and then you can adapt to your different contexts. It's a simple tool that's used on for rapid assessments. This one I've shared is basically for hygiene promotion. So they usually have assessment tools for water. We have assessment tools for hygiene promotion, and we have assessment tools for sanitation. So this one I've shared today, we'll have a look at it. It's about what questions do you need to ask when you're conducting an assessment plan for hygiene promotion. It has a list of questions that it will help you just understand the group that you're working in, and it's also be able to help you now design a good implementation plan. Okay, let's look at what we call communication. So communication is very key and is very critical in hygiene promotion, and more so during emergencies. So during emergencies, information is usually highly valued. So when information is highly valued, it means that communication is an important element of it. So the need for communication in hygiene promotion in emergencies is that it facilitates hygiene promotion because it facilitates it through active listening, information exchange, and advice to the target audience, enabling them to develop positive hygiene behaviors and practices. Excuse me. Okay, so for hygiene promotion, as we've said, it's about active listening, about information exchange, and also advice to target audience. And for you to achieve this as a communicator, let's say now as a maybe as a hygiene promotion worker, wherever you're working and the context, you need to have what we call strategies and tactics to create effective messages. Oftentimes we've seen messages being promoted, but they do not make any change. So you need to have strategies and tactics to create effective messages which motivate the target audience to protect families, communities, and nations in an emergency. I'll be sharing with you some of the examples to understand how have been able to deliver or create and deliver effective messages, and the messages that have been delivered have been able to make change in the audiences. And the two, we'll look at two examples today. So another need for communication is that identifying the target audience is critically or is very important so that you can tailor-make your communication to ensure inclusivity and high degree of participation and ownership. So it's important to target different audiences. So in the assessment tool that you will look at, you will need also to understand, for example, I'll give you an example. So when you're doing what we call an assessment of what are the key hygiene practices, what are the key risk behaviors that are being, what are the key behaviors? And then from there, you will understand who are the ones who are the key target, who are the people who you need to target maybe with a certain message. So when you're doing an assessment, it's also important to understand who will you target, because sometimes you cannot target the whole community. You cannot target like everyone. So you need to segment your audiences and understand and say, I think the problem or the challenge in this community maybe is with the women, or it could be maybe just caregivers, or it could be mothers, or it could be men, or it could be children. So it's important to identify and also segment your audiences. It will help you now to tailor-make your communication, and it will also ensure that you are including all, you're including the different audiences. So hygiene information can be communicated in different ways. So I've classified the communication approaches into two. So the first one is what we call participatory communication. So in participatory communication, it is based on dialogue or one-on-one, like you are engaging with someone. So it's usually based on dialogue, involvement, and interaction. So some of the examples that we use is household visits. Household visits, so like for example, if you have trained hygiene promoters, so hygiene promoters can do household visits, and they can do an interactive sessions with household, or they can do interactive sessions maybe with women, or they can do interactive sessions maybe with a group of men. So an example is household visits, which is usually very common. Another participatory communication also is what we call focus group discussions. You can have discussions with different groups. So you can say maybe you're targeting the youth. You can be maybe targeting out of school youth. You can be also maybe targeting school-going children. So you can have discussions with different groups. Another one, participatory communication, you can communicate maybe doing what we call transect walks. just sometimes to understand how is the community. So you do what we call a transit walk. Another participatory communication is what we call community mapping. So community mapping is about understanding the community. So about community mapping is about understanding the community. And you can use it as a way of doing communication. So you bring the community together and they can map for you their community, where they're living. So they map maybe where the schools are, they map for you maybe where they get their source of water, where they go for maybe defecation, or where their latrine facilities are. So it is usually a very interactive and engaging a tool. So community mapping is also part of participatory communication. We also have what we call community dramas and puppet theaters. So these are also brings people together, and it's usually interactive. It's usually very exciting and engaging, and it's a way that you can use maybe to communicate maybe your information or the message to the people. Another one also is about songs and stories. These have been also used as part of participatory communication to reach maybe to people. Another one is also about role plays. We also have what we call three-pile sorting. These are usually used in some of the approaches, and also what we call pocket chat voting. So here people vote maybe about hygiene behavior, which they think maybe it's a good or a bad behavior. So the main aim of participatory communication, it aims to understand the perspectives of the affected community and tailor interventions to their specific situations. So the goodness with the participatory, it's about engaging with people. You really, when you sit with people, you understand their perspectives, and this usually helps you now to tailor interventions to the specific situations. So when you engage people in dialogue, in involvement and interaction with communities, you will be able to understand their perspectives, what they think about a certain behavior, why they are doing it, and what they think would be the best way maybe for them to change. So this is about bringing change through participatory communication. So also participatory communication encourages communities to play an active role and influential role in institutions that affect their lives. As we've seen, the examples that I've provided of participatory communication, it encourages communities to play an active role because they are part of it, they are involved, and so they're able to give you, it gives you what we call, you're able to make good decisions because it's based on what the community wants. So, so the use of participatory communication facilitates a better understanding of people's different perceptions, priorities, and needs. So WASH-related information can be tailored to specific situations. Feedback also can be used to improve the response, and problems can be identified earlier on. So if you use participatory communication techniques that we've talked about, you are really able to understand the perceptions of people. Maybe you want to maybe to give information, or you want to design maybe a hand washing maybe intervention. So listening first and understanding what people really want, what motivates the people, it will help you now to be able to tailor your approach maybe to specific situations. And also you get feedback, and the feedback that you get, it helps you improve the response and problems, that you can also identify problems and also be able to solve them. One disadvantage about participatory communication is that it can be challenging maybe in areas that are isolated or remote areas, or where insecurity and severe public health risk requires a remote response. So sometimes, because this one is more participatory, that maybe you want people to visit households, you want to bring people together, it's usually a challenge when you're working maybe in areas that communities are isolated, or maybe access to communities is usually a challenge, or areas where there's a severe maybe or insecurities. Usually participatory communication is usually a challenge, and at that point maybe you will need to use another approach. In that you cannot use participatory communication in where communities are isolated because maybe of insecurity. So the other disadvantage I was talking about is that because it's more of you want to engage communities, so it means you need to have hygiene promoters, you need to have people whom you need to train to be able to undertake some of these activities. So usually that is also a challenge for participatory communication, in that even though it's not an expensive approach to use, it usually requires substantial time. You need staff, and also you need time to train people to be able to engage community. So for example, what we talked about, if you need people to go for household visits, it means that you need to have hygiene promoters, you need to be able to train them, and they need also to have time to be able to go for household visits. So that's usually that's a disadvantage for participatory communication. Okay, so before we move to the other part of communication, so we can take a 5 minutes break, and then we can come back and continue. Oh, over to you, Eric. Thank you.
Thank you so much, Rose, for the first half of the presentation. And I can see questions are being sent, so I'd encourage our participants to continue sending the questions to the Q&A section. Kindly let's avoid sending questions on the chat, because as people continue talking, the questions seem to be overlapped. So any question you have, be it concerning the webinar we have today, question concerning WASH, or any other question concerning Humanitarian Global and what they do, kindly write them on the Q&A section. Just a 5 minutes break, we'll be back in a few.
According to United Nations, it has been established that 1 in 3 people do not have access to safe drinking water, 2 out of 5 people do not have a basic hand-washing facility with soap and water, and more than 673 million people still practice open defecation. These statistics are worrying, and the continued increase of unsafe hygiene practices are a health hazard to many people across the globe. Thus, effective and sustainable interventions are needed to reduce spread of such diseases, which will alleviate human suffering and ultimately save lives. When more people such as local emergency response workers develop a good understanding of water, sanitation and hygiene strategies, more lives will be saved. To help in these efforts, HumanitarianGlobal.com has worked with world's best WASH specialists to develop a comprehensive online diploma program in WASH that will help participants to acquire enhanced knowledge and expertise in water quality issues. In this module, you will get introduced to water quality issues and learn more about water safety plans, water treatment and water quality surveillance and testing. Secondly, sanitation. In the second module, get to learn about sanitation in schools and emergencies, sustainable sanitation and how sanitation links to health, nutrition, agriculture and food security. Thirdly, hygiene and disease transmission. In the third module, you will learn more about hygiene improvement, disease transmission routes and the F-diagram and hygiene perspectives at both household and community levels. And fourthly, hygiene types. In the last module, you will get to learn more about hygiene types such as personal, environmental, domestic and food hygiene types. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Glad to have you still with us as we begin our second session. Rose, are you there with us?
Yes, Eric.
We may continue with the second session of the
Sure,
presentation.
thank you. Okay. Allow me share my screen once more. Okay, so I hope my screen is visible.
Yes, it is.
Thank you so much. So welcome to our second session. So we're talking about communication. So we talked about past communication. Now let's look at let's look at the second one, or that's what we call mass communication. So mass communication, it includes what we call public announcements. So public announcements is, for example, what we usually use when you are doing social mobilization, or maybe letting people know maybe about something, about maybe a program, or maybe about maybe the need for them maybe to participate, maybe for example in a hygiene promotion exercise, maybe, or about we usually use it mostly like when we are letting people know maybe there's a vaccination exercise. So that's an example of public announcements. Another also is about radio and TV, text messaging, maybe bulk text messaging, print media, and various IC materials such as posters, flyers, and billboards. All these fall under mass communication. Mass communication means if you're reaching a large number of people, you're reaching a large number of people. So mass communication allows for dissemination of information and give messages to large number of people, and it's usually very cost effective in that you can reach so many people at a go. This mass communication has been really used mostly in emergency risk communication. So when you want to deliver a message in emergencies, the approach that has mostly worked is on using a mass communication. Maybe I would give an example. So when COVID came, so what mode of communication that was used mainly was on mass communication, because it was thought that it would reach many people at a very shortest time. And then also it was also because it was also easy maybe to distribute maybe flyers and posters, and also the use of billboards. So mass communication was used mostly like, I was giving an example during COVID response. So it can also reach people who are otherwise isolated by geography or conflict. So unlike what we talked about in participatory communication, you cannot use it when you want to reach people who are isolated, maybe in a conflict, or maybe people are isolated, or people are in an insecure place. So it usually have maybe their challenges of access, maybe hygiene promoters may not be able to go, maybe do household visits. So one way of addressing this is by use of mass communication. So another important aspect about mass communication is that information can be audio recorded, or it can be visualized, and can retarget groups who have limited literacy. You can design your maybe posters or flyers to target people who maybe have limited literacy levels, or people who are not able to read. So you can design posters, maybe just using images, so people are able to relate with it. So that is also an advantage of mass communication. Okay, so still on mass communication, it's usually one-way medium. So there's no way that you're able even to gauge if people are really understanding the message, because there's no participatory element to it. So there's no interaction. It's a one-way medium. So even getting to know if the message has really reached home, it's usually quite difficult. It is important that even as much as we're using a mass communication, we can reinforce the messaging that we do on mass communication using local hygiene promoters who are able to use the participatory communication means. This means that it's important to not use one method. Don't use just mass communication alone. Reinforce mass communication with participatory means of communication. Usually in crisis, there's need for messages to evolve, such that messages that you give out maybe during an emergency phase, they need also to be changed, because it depends on how crises are evolved. So messages should be also be able to change, and also to be able to adapt to the changing context. And also it also gives you also a deeper understanding of the situation. So that's about mass communication, on the ways that you can use it, and some of the examples of mass communication. So you usually find like the key, maybe like maybe I can give example about WHO and maybe a new UNICEF. They usually have IC materials are usually are pre-designed. But for them to be effective, usually encourage like to adopt the materials to your own local context. I would also give an example. During COVID, there were pre-designed. You would find that maybe you're working. Okay, so let's now talk about hygiene promotion approaches. So these approaches, just allow me to say that these approaches are usually used or applied in emergencies and development contexts. And we have 4 categories. So we have participatory approaches that focus on improving sanitation and hygiene conditions. We have approaches that target children or the immediate school environment. And we have approaches that mainly target women and girls. And we have approaches that are based on behavioral science. Because we don't have enough time today, we'll focus on the first one, on participatory approaches focused on improving sanitation and hygiene conditions. So under this category, we have, I've picked 4. I know there's still many more, but I've picked 4. So the first one that we'll talk about briefly is on what we call CLTS. As much as it's not an hygiene promotion approach, but it is usually an approach that you bring people together. Usually bring communities together, they do their own appraisal. It is usually an approach that has been used to end open defecation, but it's also an approach that can be used to promote also not just sanitation, but also on hygiene, because it encourages people to improve their situations, mostly their sanitation behaviors. It also enables people to make their own decisions and changes in their communities. And then the other one that we have is what we call FAST. So what we call participatory hygiene and sanitation for transformation. So it is a participatory learning and planning methodology. So it has, it's a step-by-step approach. So it has about 7 steps that are designed for usually work with extension workers to promote hygiene and sanitation behaviors in rural communities. The third one is what we call Mom's Magic Hands. It's a hand washing behavior change approach. And the other one is what we call Sani Tweaks. Sani Tweaks is about sanitation, where you make a few changes on sanitation to make sanitation better. Because of time, I will focus on 2 of these approaches. I'll focus on Mom's Magic Hands and Sani Tweaks for our session today. Now, so Mom's Magic Hands, it is an approach that was developed by Oxfam. So in 2014, so Oxfam, in partnership with Lifebuoy and Unilever, they examined the challenges of achieving effective hand washing with soap at key times. So Mom's Magic Hands, this one where it was focusing on hand washing with soap. So the behavior they wanted to change was on hand washing with soap. So they conducted a research because they wanted to understand what motivates and what are the key motivators and what are the barriers to hand washing with soap. So they used what we call barrier and motivator analysis. It's just a tool that helps you understand people's behaviors and understand also what motivates people to change their behaviors. So you assess the factors, and that helps you to understand like what really makes people what motivates people to do a certain behavior, or what can hinder behavior change. So motivators and barriers. So motivators are usually positive drivers that motivate people to practice maybe healthy hygiene behaviors. And barriers are usually factors that prevent people from doing it. So what motivates people, for example, maybe it is about the longing to be to belong to somewhere or to belong to a certain group. And barriers are usually physical. So barriers that can make people maybe hinder people from changing a behavior. Barriers could be access to facilities such as soap. A barrier can be water. A barrier could be suitable toilets. Barriers also can be social because of the norms and customs, or maybe lack of trust to health workers, or maybe there's no access to health information. So that's also social. Also can be barriers. Also can be social. So they can be social, they can be physical, and also they can be biological. Meaning maybe the people may not be able to understand. So barriers. So they needed to understand what are the motivators. What motivates people to maybe wash hands? What are some of the barriers that can make people not maybe adopt hand washing? So from their research, they found that emotional motivators like nurturing and affiliation can motivate mothers to wash hands with soap. So this project, they were focusing on, before they designed of the project, so they were looking at women and also mothers and caregivers. So the 2 motivators that they worked with is what we call nurture and affiliation. So nurture is about caring for and bringing up children in relation to mothers and caregivers. So it was found to be the most powerful motivator driving hand washing with soap among mothers, because mothers are usually caring, and also so it's about nurturing. So they also found that even during a crisis, mothers continue to nurture their children and also because they desire to ensure that they develop and succeed in their lives. So mothers are usually like nurturing, they are caring. So they use that motivator to be able to design this project, or the approach really is an approach. So the other motivator that they used is about affiliation. So affiliation is about belonging to a group. So it was also seen as a driver in emergency context, in that mothers tend to unite together during emergencies. They come together, they support each other, and also they share resources. So it's about affiliation. So they used these two emotional motivators to understand what really motivates women or mothers to wash hands with soap. So these findings now enable them now to design this interactive behavior change program. They call it Mom's Magic Hands. So this Mom's Magic Hands, it has promotional activities, it has tools, it has a training program for hygiene promoters and also for hand washing champions. So the main aim is about encouraging hand washing with soap to prevent diseases like diarrhea. So let me talk briefly about some of the materials and activities in this model. So they use what we call an engaging story. So this engaging story is about a woman. It's about a mother and her efforts to ensure that her daughter, about nurturing her daughter using what we call magic hands. So it's the hands of the mother was seen as magic. So a mother, so a mother is able to nurture her daughter, making sure that they do well in school, that they have good food, that they're able to access good water. So it's just about a story of a mom who was nurturing her daughter. So apart from the story, so the story usually is the key narrative in this program. And then also they used other promotional materials and tools. So they have games, they have interactive activities, they have what we call nudges, and also they have what we call visual reminders. So in this project, the participants were engaged through consultations and dialogue using the tools, which led to the actions of the target group in ensuring that they wash their hands with soap. So let me talk about what they used. They used what we call cues and nudges. So cues and nudges are used to encourage behavior change. So they facilitate a rapid and improved individual decision making through small changes in the environment. So the cues and nudges, you just make a very small changes in the environment, maybe the hand washing environment, or maybe even in a sanitation environment. You make a very minimal changes, but these changes are able to encourage behavior change. So I'll give you examples from that project on some of the nudges that they used. So one of the nudges they used is what we call, allow me just to, so it's about using mirrors, this one here. So what they did is that they hung mirrors over communal hand washing facilities. So then the mirror is like the nudge. So it nudges people to visit the hand washing facility and to wash their hands with soap after using the toilet. The use of mirrors has also been used maybe when we also in when you're working with small children. So when you work with small children and you put a mirror next to a hand washing station, children are likely to wash their hands because they want to look at themselves in the mirror. So usually mirrors are usually a nudge that you can use to encourage hand washing with soap. Another nudge that they used is what we call, they used blocks or color-painted footprints. It's about the footprints. So from a latrine, you put footprints maybe to a hand washing station. This also has been used when you're designing hand washing programs for school-going children, because usually school-going children are usually attracted by something, like something unique. So when you put the footprints, so they become a nudge. So when you place the footprints on a communal toilet, so it usually serves as a nudge, and it triggers people to wash their hands with soap. So these are examples of nudges. So another one that they used is what we call posters. So posters were placed in strategic locations at households and public areas. So these ones usually serve as reminders. So they served as reminders for hand washing with soap. And also they gave them a reminder about the story of the mom's magic hands. So they used what we call posters. Another nudge that they used is what we call stickers. So stickers were placed in strategic locations. So there are many locations that you can use the stickers in. So they placed stickers depicting scenes from Mom's Magic Hand story. So they did it, they placed stickers maybe in the household, maybe at the community, at the health facility, or at the dispensary. So these stickers were also serving as a reminder. So these nudges, you can use them in designing hand washing programs, not just the Mom's Magic Hands, but you can use them in designing hand washing programs, even for school going children. Usually really works with children. So where it has been about its applicability, about Mom's Magic Hands. So this one has been found to be relevant in all emergency phases in promoting hand washing behavior. So this approach also was worked in emergencies, and it has been targeting mostly mothers and caregivers. So because also caregivers also found to play significant roles. So that's why it's about, it can work in different contexts. It can work in emergencies, and also it can work in the development context. So it has been used, this approach really has been used across the humanitarian sector and in many countries. And I was looking at from their website, I found that it has been used in over 25 countries in WASH projects. So it's also good to know that it's not a standalone project. It was done within the WASH component of a project. So it has shown an evaluation of this approach was shown to show an increase in hand washing with soap at key times by up to 70%. So this is an example of an approach that's targeting communities. So this is about hand washing. So allow me to talk about the second one, which was about, it was focusing on sanitation. So it's called Sunny Tweaks. So Sunny is sanitation, and Tweaks is it's just the English word of to tweak. To tweak is just to make a few changes. So Sunny Tweaks is all about sanitation. So what led to the development of this approach was that it was also developed by Oxfam. So Oxfam did a research that was looking specifically about, the research was called Shining a Light. So it was about how lighting in or around a sanitation facility affects the risk of gender-based violence in camps. So that's what led to the development of this Sunny Tweak. So it was looking at sanitation, but with a gender perspective. So you find that this is based on that study, they were able now to come up with this approach. So studies showed that usually as agencies, we fail to adequately consult or collect and act on feedback from the users of latrines that we build. So as a result, you'll find that most of the time, women and girls will stop using the latrines as they find them maybe inaccessible or unsuitable and unsafe. So this one, just remember like what we talked about engaging the community, engaging the users. Before you design maybe like a sanitation facility, that the importance of engaging the women. So this project or this approach, so what they did, so they did a research, and they found that most of the latrines showed that an average maybe of about 40% of women were not using the latrines. So from their study, which you can look at it later when you have time from their website, so they found the key reasons. What were the primary reasons of why women were not using latrines? Yet latrines had been constructed in the camps. So one of the reasons was about inappropriate locations. Inappropriate locations in that some of the latrines were quite far from where they were living. So they found like they were inappropriate locations. Another reason that they found why women were not using the latrines was that there was lack of privacy, in that maybe the screens that are provided or maybe the walls, they were not well, they had fear, like people were peeping at them. So privacy was not provided in the facility. Another thing is about fear of sexual harassment. Also, this is also related to the location, maybe wherever the facilities were located, women maybe were walking a long distance, so maybe they were likelihood that they would be sexually harassed. Another reason they found is that the facilities were dark. There was lack of lighting, and mostly at night. So you'd find that women would not go to the latrines or use the sanitation facilities at night because of it was dark. Another reason they found was that there was lack of proper durable locks on doors. So usually women want to, maybe when they use a facility, when you get into a toilet, you're able to lock it, use the facility and be able to get out without someone maybe just opening the door. So one of the reasons they found in that research is that proper locks were not provided. Another reason that they found was their fear of vermin, like maybe the facilities were constructed in an area where maybe there were snakes or scorpions. So these are some of the primary reasons they found why latrines were not being used by women. So based on that, based on this, the reasons, so it means that if latrines are not used, so if we are constructing latrines for women and they are not using them, it means that the time and resources are wasted and we are really failing on our mission to reaching the communities. So if communities are not using, or if women are not using the latrines, it means there will be greater levels of open defecation or other alternatives. So this open defecation or other alternatives that people seek, it takes us back now. We are putting the larger community at risk of diseases. So based on that, what we've talked about, so based on these reasons, so they now came up with this approach of the need to consult and involve users at every stage of the process. So consulting users when you're designing and agreeing on a location, you consult the users on the management and operation maintenance. You also engage users, making sure that latrines are in use. So it's about asking questions at every step when you're developing the most appropriate latrine. For this case, we're targeting the women. So you ask questions during the design, you ask questions about management and operation, you ask these questions when you want to make sure that latrines are in use, and also discuss practicalities with the community, the location, the design, the maintenance, where hand washing maybe a facility should be placed, the operations. For example, like if it is a communal latrine, who will be making sure that it's clean? Maybe you can, they can agree on who will be doing the cleaning of latrines. So it's about consultation. So it's about, the term is tweaking, like just understanding at every step, are we doing the right thing? What do women want? What kind of screen do they want? What kind of maybe height of a facility do they want? What kind of space maybe do they want in a latrine? Because sometimes we construct latrines that are so small, and maybe women maybe they need to change or they need to do something. They find the facilities are very small. So also about maybe the size of facilities. So these sanity tweaks, it's not just about understanding the needs each step of in sanitation. So applicability of the sanity tweaks, so this can be applied in all contexts. As you can see, it's not only about women in an emergency setup, it also applies to women all over. So it's about understanding and also tweaking to make sure that the facilities that you're providing is able to provide, it's supposed to be used optimally. So it's also relevant, as we've talked about, in emergency worst responses. So because usually in emergency worst responses, we usually put up facilities so very fast and we rarely consult users. So you find after some time, after you put up facilities very fast, you find that open defecation is still rampant. For example, maybe in a camp setting. One of the reasons is because we did not engage the users. We did not understand the needs of the women. We did not understand the needs of the men. We did not understand the needs of the maybe children. So it's just about understanding and making consultations so that you're able to make small changes and to ensure that there is optimal use of the facilities. Okay, so the evidence of this effectiveness of this approach. So the use of the study tweaks tools has been shown to prompt practitioners. So this is more looking at practitioners to change their approach, consulting more regularly with users and tweaking, making small changes as in sanitation facilities to improve their privacy, comfort, and safety. So if you want to learn more about the approaches, you can join us at Humanitarian Global, and we have 3 levels. We can do a certificate, you can do a diploma or postgraduate. And because today we're just giving a brief overview, you may be able to learn even more, even with practical examples, and also to understand how you can apply what you've learned also in your context. And these approaches, as I've said, they apply both in humanitarian, also they apply in development context. So it gives you an understanding. You will understand, how can I make my hand washing, for example, a hand washing program very successful? How can I make my hygiene promotion program very successful? So you'll be able to understand more about this. So thank you so much for the time. And also we can now I can look at some of your questions and try to respond to them. Thank you. Over to you, Eric, as I look at the questions.
Thank you, Ruth, for such a wonderful session and for guiding us through. And I think as of right now, we'll just go to the Q&A. I can see our participants were able to share a few questions they had.
Okay.
And for everybody else who is sending the question through the chat, kindly redirect that to the Q&A section so that we are able to answer them. Once you share them on the chat, they get overlapped due to the many messages we are getting. So any question you have again concerning the session today, or just Humanitarian Global as a whole, kindly send it to the Q&A. Thank you. Rose, over to you.
Yeah, sure. Thank you. Okay, someone is asking the difference between sanitation and hygiene. So in sanitation, some of these concepts sometimes really overlap. But when we talk about sanitation, we are talking mostly about providing facilities for maybe disposal of waste. Like, for example, an example in sanitation, we focus maybe on excreta disposal and maybe provision of latrines. But hygiene is more of what we've talked today, is about behaviors, because we can provide a facility like a latrine, but hygiene focuses more on the behavior, the use of that facility and the change in behavior. Someone is asking about the importance of washing in emergency situations. I think this one we've covered partly in this discussion today, and we say that the importance of wash is in that we've looked at some of the statistics that there are real cases that are usually quite high in emergency situations or also in development. So one of the things that WASH really improves in making sure that there's reduction in diarrheal diseases, and that we are able to, that is usually the priority really, to ensure that we are able to control and also diarrhea-related diseases. Diarrhea-related diseases are quite a number, and usually we have cholera, we have cholera, we have dysentery, we have so many WASH-related diseases, and we also talked about other aspects of WASH that the importance of them is in that we're also able to have clean environments. We talked about solid waste management. We also talked about ensuring there's drainage. So there's a whole lot, but the key thing really is about prevention of diarrhea-related diseases. Someone is asking about LRRLD. So it is an acronym for linking, relief, rehabilitation, and development. And it's a whole concept. I just brought it in, but it's a whole concept on how you can link relief, rehabilitation, and development. And I gave an example, like usually we need to link in relief or in emergency sanitation, for example, we provide people maybe with packet latrines or put up maybe trench latrines, but communities need to move up to ensure that after that, we may be able, you move them and work with them to be able to put up maybe more sustainable sanitation systems. I think I've answered this. Someone is asking about difference between hygiene and sanitation. Oh, sorry, about STDS, it's about standards. It's an acronym, sorry. Sorry, someone is asking about this term I've used here. STDS, it is standards. Okay, hygiene and sanitation issues. Someone is asking about sanitation and hygiene issues. One of the things we've talked about today is hygiene promotion, which is a key component of, if you've been listening keenly, I think you've been able to understand the two terms. Okay, someone is asking, how could cash distribution is considered as hygiene promotion for the economic? Okay, so this one, economically deprived community. Doesn't it mislead the project call to aid dependency? What's your experience? Okay, so this one, okay, so in emergencies sometimes, or let me give you an example from maybe a refugee setup. So the cash distribution part, it's usually not provided maybe during an emergency, but there are communities that have reached stabilization phase, or who are the communities who are more stabilized. So instead of giving them maybe soap, maybe in a bucket, usually agencies usually provide them with cash or voucher. So this voucher or cash, they can be able to maybe to procure their own hygiene promotion items. So usually it's not about the economically deprived communities, because we are working with maybe people who have maybe they're in a refugee setup. So they usually don't have a way of maybe earning anything. So a cash distribution has been another alternative that has been used. One of the reasons also for cash distribution, it is from another angle, in that sometimes people are given food. Sometimes maybe people are given food as part of distribution, but you find that people go and sell the food that has been provided for them. So you find that agencies have been thinking, maybe if cash is given to the community, they can be able to plan their own life, or they can plan to say, maybe this money will buy food, maybe buy something, and maybe do something else. There's been also a discussion about cash distribution in maybe putting up sanitation facilities. So those are still some of the things that are evolving about cash distribution in maybe in refugee setups, or in this working among displaced populations. Someone is asking about strategies for the community resistant to hygiene promotion activities. Okay, so it all goes back to what we talked about, engaging the communities. So before even you design any hygiene promotion activity you want to do, it's not about the resistance, it's about how you engage the community. I can give you an example, like when the approach of CLTS came on board, many people thought that most communities were resistant to it, but it was all about how communities are facilitated to understand a concept or to understand what you're doing. So the way you engage a community, it helps you to really penetrate a community. Communities, sometimes people talk about communities are resistant, but sometimes they're not resistant. It's about our approach, maybe as a facilitator, or maybe as maybe you are the facilitator. So it depends on how you engage the communities. Okay, so about FAST. So because, okay, today we didn't have time to talk about FAST. So there have been pros and cons of FAST. So FAST has been found to be a good approach in implementing hygiene promotion activities in mostly in rural setups, but in the humanitarian setup, there is another approach that is called fast. Like fast, but we don't go through the 7 steps, usually compressed into about 4 steps. So this one, if you have time, you can maybe join the institute where we can learn more about the first approach. But it is an approach that I've applied before in a rural setup, and it is usually a positive approach. Okay, so someone is asking about the components. So the components of hygiene promotion that I talked about, someone is asking if they can only be used in emergency hygiene promotion. So the key components, as you looked, as if you were listening keenly, those ones were really targeting emergency hygiene promotion, because we're talking about, for example, having maybe like, for example, talk about distribution of hygiene kits. So some of the aspects of the components that we talked about are really relevant for emergency hygiene, but there are some components that apply in the normal wash. For example, monitoring. For example, community participation. Some of those components apply in the normal wash, in a normal wash project, or in a normal, maybe you're working in the development context. Yeah. Okay, someone was talking about, I talked something about 3-pile sorting. So this one usually, you find this, it's usually a task or an activity that is usually undertaken when you're doing fast. So usually when you're working with a community, so usually have maybe 3 sections. So you have a list of cards with behaviors. So communities now pile them based on priority. Maybe they would say, like, maybe this one is a key priority or is a key practice. So it's about for you to be able to understand which will be the main priority. So it's priority 1, 2, and 3. So usually given like the first one, 1, 2, or 3. So the one that has more, where people maybe put more, maybe more cards onto it, that's the one that the community thinks it is maybe the best behavior, or it could be a hygiene behavior that they need maybe to change. So it's usually an exercise. What step do I take for behavior change in hygiene promotion? So this one, if you've been listening keenly to this presentation, I believe that you've learned some of the steps that we talked about when you're undertaking a behavior change. Okay. I think for Garad is asking, some of the questions I've answered, importance of wash. And also is asking about working in insecure places. So this one, when you're working in places that have insecurity, it's about working with now this one needs a lot of collaboration, and also you need to work with the local government, and also work with, it's more about collaboration to be able to access, because there are some areas that you may need to access, but you may need to be provided maybe with security. So this one's about, you can still implement the activities, but you need to work with other agencies and the government to be able to implement activities. But one of the things that we talked about, that sometimes you may need to provide communication on risks, maybe in a such setup. That's when initially you can use what we talked about, you can use mass communication to be able to reach to such communities. I talked about the assessment, so you'll be able to get the assessment tool that I talked about in this presentation. For you to understand, the assessment tool that I talked about and the one I'm sharing today is specifically on hygiene promotion. So the assessment tools that you have also for water supply, there are also assessment tools that we have for sanitation. Someone is asking about link between wash and malnutrition. So there's been, there usually talk about links between, particularly let me talk about sanitation and nutrition, in that if a child, let me give an example, if a young child is living in an environment where there is a lot of open defecation. So if this a young child maybe consumes the fecal matter, it affects the gut of the child. So when a child now eats food, let me use just the layman's language, that food is not absorbed very well in the system because it has been affected by the fecal matter that maybe the child consumed. So we usually have a term. We have a term that we call enteric. It's called EED. It's a dysfunction. and this one you can also learn more in the in one of our modules that we provide. We talk about the link between nutrition and sanitation, but usually a key link between sanitation and nutrition. Okay, thank you so much, Herman, for your comment. And yeah, you've commented on the presentation. How to apply Magic Hand in poor community. So what I talked about is that if it's important to understand the community that you're working in. You understand the needs, you understand the way I talked about, you just do an analysis first. So when you do an analysis, you understand what are the barriers, and it's not really about a community is poor, because here we're not talking about maybe the ability to pay for something. So just it's about understanding the communities that you're working in. You want to understand what motivates the women, for example, in this community, maybe to do something. What are the barriers? And from that, you are able to maybe make a few adjustments and be able to deliver a good hand washing project for with the communities that you're working in. So it's about understanding your community, doing an analysis first for you to understand the communities that you're working in. Okay, someone is asking, can we set up different toilets for men and women to solve the problem of sexual harassment? What can we do when people in rural areas refuse to use the toilet? Okay, so the one about women and men, that is usually one of the aspects when, like, for example, the approach that I was talking about, sanitary. So when we engage the women, sometimes they say that we need to have a so let me say first, the standard is when you're working in an emergency setup or when you're working in a humanitarian setup, it's important to do separate. That is a standard. You need to have separate toilets or latrines for men and for women, and you need to provide what we call a screen. And also the entrance has to be different. How women enter the toilet. So it is the entrance to the toilet facilities for men should be different from women, so that at any one point, men are not seeing women going to the latrine, because sometimes women fear because they don't want to be seen going to the toilet, for example. So there's need to set up different facilities for men and women. What do we do when people in rural communities refuse to use toilets? You need to use different approaches. One approach that you can use is the CLTS. I'm giving an example. So when you engage people and take them through the process of using the PRA tools for CLTS, people will start seeing the need of using our latrines. How we can apply, someone is asking if we can apply magic hands, mom's magic hands. Yes, we can. That's why I talked about when you later read through the slides, you will understand that mom's magic hands is an approach that has been tested and has been used in different setups. It has been used in emergencies, it has been used in urban areas, and it has been used in rural areas. I also provided a reference that it can help you maybe read more about it and understand about that approach. Someone is asking about CLTS, even though we did not talk about CLTS today. So we have CLTS in urban settlements. So we have what we call urban-led. So this CL is community-led. So we have a concept of urban-led total sanitation. And I've worked in projects that have focused on urban sanitation, and I've used the urban approach of CLTS. So it is also possible to conduct CLTS in urban settlements, maybe particularly in informal settlements. Someone is asking about different standards of WASH. So the standards that I talked about, so WASH, we have standards for hygiene promotion, we have standards for sanitation, and we have standards for water supply. But at the end of the day, the key thing is about ensuring that people live in good environments. We are able to protect lives, and we're also able to to make sure that diseases are controlled or prevented in emergencies. Someone is talking about accountability. So I talked about, when you engage communities, so when you engage communities, maybe like, for example, when you're doing hygiene promotion. So I talked about bringing communities together, and what we call accountability is about what are we providing and are we able to meet the needs of the community. So, when you bring communities together and work together, you'd be able to know, am I really meeting the needs of the community? So you are accountable to the community and you're able to meet the need of the, you're able to meet the needs of the community. Someone is asking about implementing effective hygiene promotion program. I think we've talked about, and I think the person will be able to look through the slides and some of the references that are provided, and will be able to understand them more. Someone is asking about wash promotion materials in case of emergency or conflict affected areas. So I talked about they're usually pre-designed. I talked about sometimes we have what we call pre-designed materials. So you can use pre-designed materials, and also you can use in conflict areas. Maybe there are areas that you're unable to access. You can use mass communication, but also you can also work with other teams because you are not working in isolation, and also you're working with other members of the teams. So you'll be able maybe to adopt your materials to your context. Okay. Someone is asking, okay, so this is a comment and a question. The webinar is focusing on hygiene promotion, but they're asking about different water treatment approaches. So that one, we can schedule another session where we can talk about water treatment approaches in emergencies. So it's also quite a lot that needs to be done in water quality and water quantities and water treatment approaches in emergencies. So for this one, maybe we can wait, and then we can schedule another time that we can have time to talk much about it.
Hello, Rose.
Yes.
Due to time, maybe you can randomly pick 3 more questions.
Yeah,
also
true,
allow our participants to ask questions on live.
Yeah, so okay, thank you so much. Okay, so I can look through the questions. So some of the questions do not focus on what we've talked about today, but they're asking about maybe other components that we talk about, like for example on water supply and water quality in emergencies. There's someone who also is asking about school sanitation. So some of the things that we've you are asking, maybe I will hand over that to Humanitarian Global so that we can schedule as other sessions that we can focus on some of the questions that are being asked. Okay, so thank you so much. And some of the questions we will pick up some of them later, maybe through Humanitarian Global. But I want to say thank you so much for the time and also being good listeners, and also for the many comments and also the questions. And so I believe we'll have other sessions that we can be able to address some of the issues that you have raised today. Thank you so much. Over to you, Eric.
Thank you, Rose, for answering the questions. And at this time, we'd like to invite the participants also to ask any questions. So what you shall do is you shall raise your hand, and I will get to unmute your mic, and you can get to ask Rose a question. Yeah, so I can see a few hands up. I will start with Kiden. Kiden, kindly unmute your mic. Kiden, are you there with us?
Yes, Eric, but I think I put it by mistake. I did not put up my hand, sorry.
Yes, Kiden, you may ask your question.
Hello.
Hello, Kiden, can you hear me?
Yes, I'm getting you. Hello?
Yeah. Yes, we can hear you, Kiden.
Yeah, I think I raised it by mistake. The question I already put in the chat. Sorry.
That's okay. That's okay.
Okay, sorry. My name is Anthony, and I'm trying to pick it up from Eric. He's having some maybe connection challenge. So let's move to Metabel. I can see your hand is up, and now you may try to unmute your microphone, and then you can proceed with your question. So Metabel Okumu, you may unmute your microphone, and you can ask your question. Metabel, you may unmute your microphone so that you can ask your question. Okay, as we wait for Okumu to unmute the microphone, let's proceed to Noah.
Listen it again.
Yes, it's your turn. You may ask your question.
Okay.
Yeah.
Thanks. My question goes like this.
Yeah, proceed.
Yeah, I would like our presenter to explain something here for me concerning this. What are the key priorities to improve the? Are you getting me?
Or who is he asking you to?
Yeah, yes, sorry.
Hello?
Yes, we can hear you.
Okay. My question was, what are the key priorities to improve the sustainability of sanitation service in urban areas?
Okay, that is well noted. So back to you, Rose.
Then I'm having two questions.
Okay.
Yeah, and the other one is, what are the key roles for community agent promoters when there is no tools for demonstrating hygiene and sanitation in rural areas?
Okay, that is well noted. So Rosa, maybe you may proceed and respond to that.
Okay.
Okay, thank you. Rose, your microphone is on mute.
Yes.
Yeah, now we can hear you.
Okay, sure. Thank you so much. If I got your questions clear, are you talking about the role of hygiene promoters? Okay, in promoting hygiene in a rural setup. Okay, so maybe I hope I got the question right. And it's talking about maybe challenges, maybe they don't have tools. So, okay, so one of the things is about, before you engage hygiene promoters, as what we talked before, is about you need to build their capacity. So you build their capacity to understand their roles. So when they're going to communities, they have the knowledge and the know-how on what they're going to engage communities in. So the key aspect here is about building their capacity. So oftentimes, maybe they don't have tools, but it's important, whether it's a government, let's say if it's a government that is sending hygiene promoters or who have hygiene promoters, or if it's about agencies that are partnering with governments, it's important to make sure that we are providing them with the means and the tools to be able to maybe to undertake their duties. But sometimes you may find that there are challenges, but we usually say, we encourage innovations. Let me give you an example. If you are undertaking, for example, a CLTS activity in a community, so CLTS sometimes it requires you to have some tools, or some tools that you need maybe to do like a community mapping. So whereas may not have the tools that are bought, we usually say we encourage innovations. Look for innovative ways within the community to be able to get maybe the tools that you want to use. So it's hygiene promoters can be maybe deployed in communities, but sometimes maybe they may not have the tools, but they can also be able to innovate. So innovation is the key thing here. Okay, so and then it's talking about urban sanitation. So that's urban sanitation. We've not talked about it today, but I can just mention that it's about sustainability really begins at the onset. sustainability for any project, whether it's a hygiene project or sanitation project, whether it's in the urban or the rural or emergency setup, we talked about engaging communities. So if you engage communities at the onset, that's one way of ensuring that you are, it's like building sustainability. So building sustainability begins way back when you start engaging communities, and then other aspects now can come in. But the key thing really is about building communities to be able to own and sustain the interventions that you have put up. Thank you. Thank you. Over to you, Eric.
Thank you for that, Rose. I don't know if you can hear me.
Yes, I can hear you, Eric.
Oh, that's okay. Thank you. I can see Daniel Magok.
Good afternoon, everyone.
Good afternoon.
Yes, I just joined in late, and I don't know whether people started with introduction earlier. My name is Daniel Magok. I just joined in from South Sudan. My question goes to Rose, and is a bit, just need to make some clarification. Humanitarian Global is such a big name and very good. For us also, we have joined in as managers and coordinators, and there are some of us who have no commitments in decision making. Yet these lessons that you are sharing with us are very good, and they are so updated according to changes and innovations, like Rose said. The question is, how do we, okay, the question is Humanitarian Global Institute connected to all the WASH institutions, international and national NGOs? And if so, are they sharing those changes, the latest changes that we are talking about, such that they are encouraged or included in the programs that we do? This is what I wanted to know.
Okay, thank you, Daniel, for that question. And this is Anthony responding to you. When it comes to the mode of approach that we use, especially in regard to the training and the kind of approach, we normally engage very many stakeholders. So that means even working with other NGOs so that we can even get data from them. And then based on the feedback that we get from them, that is even how we do simulate the case studies that we use for our training. And I know you, having gone through our training, especially in the diploma in water sanitation and hygiene, you saw how practical oriented it was when it comes to the approach. So this is an initiative that we include and also work with other stakeholders to ensure that whatever we present to you, it's reflective of what is needed on the ground. Is that okay?
Yeah.
Okay. Thank you so much for your question. So back to you. Okay.
Thank you for that, Anthony. I can see a person by the name Redmi Note 10S. Are you there with us?
Henry.
Henry Mugo.
Hello.
Yes, Henry.
Yes, I thank you for the nice presentation, Rose. I wish to ask a question which is still within the component WASH, but maybe off, given that I'll be asking about water. So my question is to Rose, does she have a tool maybe to assist in selection of a water point location, which is targeted at attaining sustainability, more so maybe in the urban or peri-urban setting? That's my question. Thanks.
Yes.
Oh, Eric?
Yes, Rose?
That's Anthony, sorry. So okay, I didn't get the question very clear. He's asking about a tool that you can, it's a water tool or an assessment tool for water?
It's more of a tool to use when you're doing like a survey, when you're scouting for a water point location, which is targeted at attaining sustainability. And in this regard, I'm talking about a water point where it's where people will be fetching water, the pay as you fetch kind of approach. A water kiosk for that matter.
General tools, but the one you're talking about specifically, maybe I'll look out for it because I'm not, I would look out for it because you are a bit quite specific. Yeah, so you can share your email. You can share it with Humanitarian Global and we can get back to you with your, just to answer your question, maybe more in detail.
All right, thank you, Rose. Thank you.
Thank you for that. And due to time, I think I will take one more question. One final question due to time. I can see you have an Oppo A92. Are you there with us?
Yes, Eric, good afternoon.
Good afternoon.
This is Okot Fabiano from South Sudan.
Thank you, Okot, for joining us. You may proceed to ask the question.
Yes, my question goes to Rose in regards to the standard of the hygiene promotion, especially in the SPF standard. I tried to check. I don't know if it's my own problem or mistake. I couldn't find where it stated like in emergency like settings, like one hygiene promoter can tackle how many households, either in a day or in a week. What are the kind of setup? I mean that the hygiene promoters need to be deployed. How many households they can handle, and what are the frequency? How many times do they need to do it in a week or in a month or something like that?
Okay, thank you so much for your question. So in terms of standards, the required standard is one hygiene promoter. I'm giving a standard, for example, maybe in a camp setting where large number of populations live in a place. So the standards are that one hygiene promoter to cover a population of 500. That's the standard. So it's one hygiene promoter per 500 people, but the frequency, it depends on really, it changes. So it depends on the program that you are running or with agencies. So it depends on how you've designed your program. So there's no standard like they need to go to the households maybe every day or a week. So it's how you design your program and to make sure that communities are engaged. So there are variations. So there is a way you can just design your program, but the standard is it's one hygiene promoter to be able to reach 500 people. Thank you.
Thank you so much. Noted.
Thank you for that, Rose, and also thank you, Okot. And at this juncture, I would like to invite Anthony to close for us.
So thank you, Eric, and also Rose, and more importantly, to all of our participants for following up with our session today. I can see we still have lots of questions that you have asked. So we have taken note of them, and in the coming session, the good thing is that we're going to be having another session within the course of this month because we can see there's really a lot of areas that we need to cover. And that's why we want to ensure that we can have more sessions like these ones. So we always go through your feedback, and we can see as part of your feedback, you had asked whether we can increase the number of sessions. So the great news is that we're going to be having another session within the course of this month. So just to keep you updated on the same, we're going to have a session on the 30th of this month, that is on a Thursday. So 30th on a Thursday, and the time would change a little bit from 11 a.m. We're going to start at 2 p.m. to 4 p.m. East African time. So just take note, 30th of June this month, we're going to have another session on WASH from the time 2 p.m. to 4 p.m. East African time. So don't worry, because we're going to send you an invite, and once you get the invitation details, make sure that you can also help us in spreading the same information to your networks, to your social media networks, your friends, and your colleagues. So from Humanitarian Global, we want to extend our gratitude for setting aside time to join our session today. And I know sometimes it's not possible to cover everything when it comes to the 2 hours that we have. You can even see now it's past 22 minutes, past the 2-hour session that we had. And we appreciate your patience, and we also look forward to seeing you join us when it comes to the paid programs. So just a quick reminder, you can always go through our platform, our website, that is www.humanitarianglobal.com. That's where you can find all these information. We have the courses on the homepage, and you can even go through them and see the program that you'd like to enroll in. And then without forgetting, it's also another question that you keep on asking: how do I get the recordings for the session? So we have a YouTube channel where we are able to publish the same. So if you go to the website, there's a link here for the YouTube channel, and that is where you'd click, and then that would redirect you to the YouTube channel. And there you're going to see that we have very many sessions that have been uploaded. So we normally conduct sessions on different areas. You can see starting from maternal, infant, and young child nutrition, meal, human nutrition and dietetics, food security and nutrition in emergencies, disaster risk reduction and management, among very many others. So in case you also missed out on the first session, you don't have to get worried, because you can go to our YouTube channel and get those recorded sessions there. And when it comes to each and every session, maybe I pick on meal, you're going to see on the description, we have the link for the slides. So we're going to always ensure that the link for the slides, the presentation slides, you can get it from the description. So once we publish the recorded version for today, tomorrow, you're going to also have the link to the slides being indicated there. And also, as we said, because we have further training on these and other areas, you might be interested in enrolling on one of our paid programs for certification and also further training. You can reach out to us through the details that you can see here. And the same details, they appear on the website, meaning that you can always reach out to us. The good thing, you might be interested in speaking to Rose. Maybe you have a program that you're doing and you want to be guided by her, or maybe other facilitators from Humanitarian Global. You can come to the platform, request a call back, and we're going to set up a meeting for you. So that means we are here to support you wholly in terms of your career development, the kind of projects that you're doing. So Humanitarian Global is the go-to organization when it comes to this kind of support. Also a quick announcement. We are running a promotion discount at this moment when it comes to the enrollment for the programs. And that means with our paid programs, you can enroll and get to enjoy a 10% discount. If you go for a certificate level course, you only have now to pay $450 as opposed to $500. If you go for the diploma, you pay $900 as opposed to 1,000 USD. And that course takes a period of 6 months, the certificate 3 months. And then for the postgraduate, that is a whole year, that is equivalent to 12 months. And then that one, you get it at $1,350 after you get the 10% discount. So thank you so much to all of our participants, and from Humanitarian Global, we wish you the very best as you practice and get to implement what you've learned in this session. So let's continue spreading the word about Humanitarian Global when it comes to capacity building and these kind of resources. Enjoy them from their website. And as we said, let's meet on 30th June this month. That is from 2 p.m. to 4 p.m. East African time. And we're going to discuss more in another session, and details would be shared to you via your email. So thank you so much, and may you have a great afternoon.
In accordance with UN, it has been established that water scarcity affects more than 40% of the global population and is projected to rise. In addition, over 2.4 billion people lack access to basic sanitation services, such as toilets or latrines, and many communities are increasingly being exposed to a myriad of public health hazards and risks. Thus, WASH forms a key part of many humanitarian response programs. Humanitarianglobal.com has worked closely with experts in this field to develop a detailed online postgraduate diploma that offers extensive knowledge and information resources about this practice area. In the provided 8 modules, the learner will get to learn about water supply in emergencies. In this first module, the participant will get to learn more about intervention context, sphere standards, and consideration for linking relief, rehabilitation, and development. Secondly, pumping equipment. This module will cover the various pumping equipment used in WASH, such as hand pumps, centrifugal pumps, hydraulic ramp pump, and the forms of energy sources that can be used in powering these pumps. Thirdly, sanitation hardware systems and concepts. The third module will cover basic concepts of sanitation, sanitation options, dislodging of pits and septic tanks, and reuse-oriented sanitation technologies. In addition, you learn more about sanitation software systems and concepts. In this module, the learner will get to understand more about the sanitation ladder, sanitation-related behavior change, sanitation marketing, and sanitation approaches such as CHAST, PHAST, and CLTS. The other module is sanitation in different contexts. In the 5th module, you will get to learn about sanitation in different contexts such as schools and emergencies, sustainable sanitation, and the linkage between sanitation, nutrition, agriculture, and food security. In the next module, you learn more about hygiene and disease transmission. This module will cover hygiene promotion, disease transmission routes, and the F-diagram and hygiene perspectives at both household and community levels. Also, you learn about hygiene behavior change. Under this module, some of the topics covered include principles and components of behavior change programs, risks, attitudes, norms, abilities, and self-regulation, health belief model, communication for behavioral impact. And lastly, hygiene promotion management, epidemics management, and global annual events. In the last module, the learner will get to develop more understanding about hand washing management, menstrual hygiene management, cholera epidemic, and other epidemics management, and global annual events. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.